evening. You're tuning in to AWANI Tonight with me, Farhana Sheikh. There will be no mixing of COVID-19 vaccines for now, says Khairy. And what can be learned from Singapore's public health approach? That's coming up. Malaysia's daily COVID-19 cases surpassed the 6,000 mark for the second consecutive day, recording 6,276 new COVID-19 cases in the last 24-hour period. 62 deaths were also recorded today. Selangor topped the list once more with 2,836 new cases, followed by Negeri Sembilan and Kuala Lumpur. Meanwhile, the contagion rate of COVID-19 or R0 on expected daily cases as of yesterday for the whole country was 1.04. Malaysia is still under Phase 1 of the National Recovery Plan and will only move to Phase 2 when cases are 4,000 or less. Leaders of both Houses of Parliament said they have informed the Prime Minister that the Yang di-Pertuan Agong Al-Sultan Abdullah Rayatuddin Al-Mustafa Billah Shah wanted the federal legislature to meet before the emergency expires in August. This is conveyed to them during their audience with His Majesty yesterday. Dewan Rakyat Speaker Dato' Azhar Azizan Harun and Dewan Negara President Tan Sri Rais Yatim gave their commitment to organise the special seating before August 1st, as proposed to them by the Yang di-Pertuan Agong. Earlier, His Majesty has said that the country's parliament should reconvene as soon as possible to discuss steps that the government has taken to deal with the health and economic crisis caused by COVID-19. Under the National Recovery Plan, it was stated that the parliament could reconvene by September at the earliest, providing the average number of daily new COVID-19 infections fell to under 2,000 cases. There will be no mixing of COVID-19 vaccines for now, says National COVID-19 Immunisation Programme Coordinating Minister Khairy Jamaluddin. Following claims that different vaccines could be mixed to try and boost efficacy, those who have gotten the AstraZeneca vaccine will still get the same vaccine for their second dose.
AstraZeneca vaccines, the second dose will be AstraZeneca. Although the expert technical working group has presented to JKGAV early real-world data on heterologous vaccinations, that is mixing vaccines, we are still studying. I think it's still inconclusive for us to make a decision to mix vaccines here in Malaysia. We'll continue to study that, and once a conclusive decision can be made, then we will announce that. But for now, you will be given the same second dose as your first dose. So if you received AstraZeneca for your first dose, you will receive AstraZeneca for your second dose.
The suggestion came after reports of early data from a German trial suggesting a combination of AstraZeneca and Pfizer vaccine doses may trigger immune responses up to 4 times stronger than if administered 2 doses of the same vaccine. As people around the world grew wary of living with COVID-19 restrictions, neighbouring Singapore has recently announced its plan to live with COVID-19, treating it as an endemic. This would include a shift away from monitoring daily cases, a focus on vaccination and an ease movement as well as border restrictions. How has the country arrived to such decision? What to expect when a pandemic turned into an endemic? We speak to public health expert Alex Cook from the National University of Singapore.
So perhaps we can think about 2 diseases which are already endemic, dengue and influenza. So they both in Malaysia and Singapore circulate year-round. They alternate between lower levels of infection and higher levels of infection. And what really prevents large outbreaks of flu or dengue is the fact that because it's been with us for years, all of our lives, many people in both populations have already been infected. So for example, in Singapore, about half the population has been infected with dengue before. So that existing immunity acts like a brake, together with other public health measures such as influenza vaccination or vector control, in order to prevent large outbreaks from happening. So what we're effectively moving towards with COVID is a situation like that, where COVID would be like influenza. There would be enough immunity in the population, either from vaccination or from natural infection, in order to prevent large outbreaks like what we're seeing just now. What we would expect when we move to an endemic state is that actually we have quite large amounts of community transmission. But because vaccination rates would be sufficiently high, we would not see large numbers of severe infections, people in the ICU, and people dying of infection. So it's really about moving away from being full of anxiety about every single case that we see in a community towards tracking only the things that really matter, which is the more severe infections that we're observing.
Therefore, what can we learn from our neighbours? How can we move towards an endemic? What should be the main priorities? National University of Singapore's public health expert Alex Cook shares his insights.
I think that one of the things that Malaysia will need to be quite cautious about is that, yes, you can plan ahead. Now is a good time to be planning what to do when you want to move into the endemic state. But the fact that variants may come into the picture, which are more transmissible and therefore would require having greater levels of immunity in the population in order to be endemic rather than pandemic. I think that's something that needs to be borne into consideration quite carefully. The key focus for Malaysia, I think, should really be about vaccination. Vaccination is going to be the key, which is going to unlock the door into this new endemic state.
Alex said in order to move towards an endemic state where restrictions are eased, preventing severe COVID-19 infections via vaccination rate should be prioritized over anything else.
Until now, we've still been in the pandemic fighting mode. And so during that time period, yes, the number of cases that we see in the community acts as a gauge about how much we can think about stepping down or stepping up the control measures. We need to move away from that thinking, though, as we move towards this endemic state. In the endemic state, when large numbers of people have been vaccinated already, then I think the whole calculus is going to change. It's going to be about trying to prevent the severe infections only, not worrying too much about preventing all the mild infections. We know that the vaccine is all the vaccine brands are actually extremely effective at preventing severe infections. So what we can look forward to is if we're able to get, especially the older age groups, to get a high vaccine coverage amongst those, is that we can relax measures, allowing some community transmission to still take place without whenever we see cases rise, going into another lockdown, another MCO or whatever. I think that will be that's the mentality that we need to try to move towards over the next year or so.
We'll take a short break. Stay with us. Welcome back. Despite spiking COVID-19 cases elsewhere in the country, the Thai government is forging ahead with a program to reopen Phuket to fully vaccinated visitors starting tomorrow. If it goes well, the pilot program called the Phuket Sandbox will be expanded to other tourist destinations. Under the program, travellers do not need to do quarantine, but they must stay in Phuket for at least 14 days before being allowed to visit other destinations in Thailand. However, they must only come from countries considered no higher than medium risk, fly direct to Phuket, undergo COVID-19 tests before arrival and during their stay, and show proof of an insurance policy that covers COVID-19 treatment, among other requirements. In preparation, some 70% of the island's approximately 450,000 residents have had at least one vaccine dose. There is already some international interest, with the first flight arriving from Qatar, Israel and Singapore. Still, there is skepticism about the plan given the tough requirements for entry. The government hopes Phuket's sandbox will pave the way towards reviving tourism, a sector that accounted for 20% of the country's economy before the pandemic. The crash in international tourism due to the COVID-19 pandemic could cause a loss of more than $4 trillion to the global GDP. According to the United Nations report, the lack of widespread vaccination in developing countries was leading to mounting economic losses. The outbreak, which brought international travel to a near halt for much of last year, punched a $2.4 trillion hole in the tourism and related sectors. The report warns a similar loss may occur this year depending on the uptake of COVID-19 vaccines globally. Vaccination rates have been wildly uneven. Some countries have inoculated less than 1% of their population, while others have topped 60%. This will see the economic damage concentrated in countries with low vaccination rates. The report says experts believe a return to pre-COVID international tourist arrival levels won't happen until 2023 or later. Indonesia recorded its biggest daily increase in COVID-19 cases today, with over 21,800 new infections. This as President Jokowi said his government is finalizing new emergency measures to fight against the second wave of infections, primarily driven by the more transmissible Delta variant. Movement curbs were tightened last week in red zone areas, but health experts say these have not been sufficient to stop the spread of the virus. Jokowi said that the hospital bed occupancy ratio was 72% nationally. However, local authorities said rates were higher in cities including Jakarta, where medical emergency units have been shifted to tents outside hospitals. Germany has caught up with the United States in terms of the proportion of population receiving one dose of the COVID-19 vaccine. Earlier this year, the German government has came under fire for a sluggish COVID-19 vaccination campaign, particularly in comparison with the countries such as the US, Britain and Israel. Health Minister Jens Spahn said 55% of the population had now received a first dose of vaccine, while 37% has had both shots. He said that supply of vaccines in Germany would soon outstrip demand. Europe is catching up with the US in COVID-19 vaccinations and could sprint ahead while parts of America struggle with vaccine hesitancy. According to data from Oxford University, EU countries including Italy, Denmark and Belgium have already passed the US by the percentage of people who have received at least one vaccine dose. Images in the news of once pristine jungles scarred by logging continue to shock Malaysians. Who is responsible for these practices? Tonight on Consider This, we ask our guests about the environmental and social impact of deforestation. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. We'll see you again.
Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Pahang is the most forested state in Peninsular Malaysia. But one of the most concerning issues, concerning losses is in the Bukit Ibam Forest Reserve in Pahang, of which 85 square kilometers have been carved out for a plantation project. This is the single largest forest reserve loss in Pahang in the last 2 decades. So tonight on the show, we'd like to look at what's happening there, but not just the environmental impact of the deforestation projects like the one in Bukit Ibam, but also how projects like those displaces indigenous people who have lived there for many years. Let's begin the show now with Dr. Lau Yao Hua. He's a science journalist for Makaranga, which is a portal covering issues of the environment and sustainability in